Um, Hello, hi. Good morning. Let us continue our daily live streams on IVF series. Today we will be covering Ovarian Reserve. So it's very short live stream, so mainly tailored for patients, but maybe useful for members of public as well. Okay, so we're covering whole IVF journey. We're still in the stage 1 of IVF journey, and we're covering step 7 today. So which is assessment of ovarian reserve. Okay, so women born with a set number of eggs. Once they're born, they cannot create new eggs. So as they get older, they lose a reserve of eggs. Some women born with very little number of eggs and they become infertile much faster because they run out of egg reserve. And others born with average number of eggs and they have average duration of their reproductive life. And the third group of women have very high ovarian reserve and they stay fertile much longer. So, and the individual patient's ovarian reserve we can measure, assess using these 4 markers: age, FSH, AMH, and antral follicle count. Let us cover one by one. So as we discussed in earlier slide, this age determines overall ovarian reserve. However, age is not very accurate marker, which we will see later on. So FSH is indirect marker of ovarian reserve because FSH is produced from a pituitary. It's not directly produced from the ovaries. So FSH is produced in response to activity of follicles in ovaries. If you have a high number of follicles, you have a lower FSH. If you have a less number of follicles, less ovarian activity, then you have a higher FSH. So, however, there are 2 markers which are very accurate, and they are direct markers of ovarian reserve because they are reflect the direct follicular activity in ovaries. So the first one is anti-Mullern hormone. Anti-Mullern hormone is produced from growing follicles. If women have a high number of growing follicles, they have a high AMH levels. So and vice versa. Then next one is antral follicle count. This is ultrasound scan measurement and assessment or counting of small antral follicles in the ovaries. Again, so if there are a lot of small antral follicles, that means ovarian reserve is good and have a high antral follicle count. So AMH and AFC correlates. They pretty much mirror image of the same thing. So now let us discuss the clinical relevance of measuring ovarian reserve for each patient before their IVF treatment. So we mainly use these 2 direct markers of ovarian reserve, AMH and AFC, to determine individualized treatment for each patient in IVF. I'll explain how. So let us take these 20 patients of the same age. They're all of them at the age of 34. If you just go by their age, you think that they have a similar or same fertility. But when you check their anti-Mullern hormone levels, you can actually determine they have 3 different levels of ovarian reserve and fertility. So let us say these 5 patients have a very low ovarian reserve, and these 10 patients have a good normal ovarian reserve, and these 5 have a very high ovarian reserve. So accordingly, we can decide stimulation protocol. Let us say in IVF, we use a gonadotropin hormone, which is FSH, which stimulates the ovaries. Let us say in these 5 patients who were found to have a low ovarian reserve, like Kyla, Melissa, Amber, Daniel, and Taylor, we should give high dose of stimulation because we should push their ovaries harder so that they can produce more eggs per IVF cycle. So in these 10 patients with a normal ovarian reserve or normal AMH, we should give a normal average dose of FSH gonadotropin. In these 5 patients, Jessica, Ashley, Amanda, Sarah, and Jennifer, we should give a low dose of gonadotropin hormone because they have a high ovarian reserve. If we give them high dose of gonadotropin, they may end up having ovarian hyperstimulation syndrome. So these 4 markers of ovarian reserve is extremely important to formulate IVF treatment protocol. This is why we assess in each and every patient, and accordingly we individualize IVF treatment protocol for each patient. So this is end of my 5-minute live stream. I wish you a great day ahead, and I'll see you next time. Thank you.